41-year-old woman present with pain in her abdomen for last couple of hours. She says pain is intermittent and localized to right hypochondriac region. She admits to eating fatty food this morning before the pain started. She complains of nausea. She describes similar symptoms in past after fatty meal. Past medical history is irrelevant. Vitals are normal. Physical examination is normal. Ultrasound of abdomen is pending. Which of the following hormone is the likeliest cause of postprandial aggravation of this patient's symptom? A. Somatostatin. B. Cholecystokinin. C. Gastrin. D. Pepsin. E. Secretin. So, can we quickly have the diagnosis first over here? What is this quash? Any normal value of DLCO? I think it is 85%. So yeah, in the chat box I saw that somebody has written that the diagnosis over here is chronic cholecystitis. This is not chronic, this is gallstone, which is choledocholithiasis. Okay, I think that there is a lot of there is usually a lot of confusion around what is cholecystitis, what is choledocholithiasis, but I'm not sure if there is scope to cover all that in this session. We'll keep that for end. If we get time, we'll discuss how to differentiate between choledocholithiasis, cholecystitis, choledocholithiasis, and all that. Okay, but for now, let's focus on this question. So basically, what's going on is that this woman had some fatty food. Let's say she ate a burger, and after eating burger, her right upper quadrant started paining, her abdomen started paining, and she says that this has happened a few times whenever she had fatty meals. So basically, all of us know that this points towards gallstone. So this patient is having gallstone. Now, what they're trying to ask you is not asking you the diagnosis. They're asking that what is aggravating this situation. So this patient normally sits well, does not have any problem, no pain, nothing. But suddenly, if she eats fatty food, she has this pain, which means that that fatty food is doing something to her body, and they're asking what is it doing, which hormone is it increasing. So answer, I think all of you responded cholecystokinin as answer. Let's see a bit of it, how all of this works, why there is pain, what cholecystokinin does, and how it happens. Okay, yeah. So basically, if you have a fatty food, you stimulate whenever you have fatty food. As soon as fatty food go in your duodenum, the body responds in such a way that cholecystokinin is released. The function of cholecystokinin is to contract gallbladder. So it contracts gallbladder and stimulate pancreas to produce certain hormone. So gallbladder has bile. All of us know that gallbladder contains bile. As soon as gallbladder contracts, this bile is released in duodenum. So basically, what body wants that as soon as I eat fatty food, there should be bile in duodenum, because bile helps in digestion of fatty food. So for that bile to reach in duodenum, it is important that gallbladder should contract. So for gallbladder to contract, it is important that cholecystokinin hormone should be present. So let's assume this is our gallbladder, okay, and this is our duodenum. Usually all the bile should come here as soon as we have fatty food, okay. But what is going on over here is, if I have an obstruction, if I have a stone over here, let's say, or if let's say I have stone over here, it's normally sitting and chilling in the gallbladder doing nothing. If it's small, no issues, no problem. As soon as the gallbladder contracts, however, what happens is this stone relocates into the cystic duct, and now the gallbladder is contracting against an obstruction, and that causes pain in right upper quadrant. So this is how cholecystokinin works basically, and how it causes pain um, in gallstone disease. So if this is clear, we can move ahead to next question. If there's any doubt, just put it in the chat box. Um, Yeah, I think that for the previous question, there was one more point that I missed. The previous question was about idiopathic lung fibrosis. I did mention about honeycombing, which shows alternate inflammation in normal lung, due to which there's honeycombing. There's a very specific feature of idiopathic pulmonary fibrosis, which is known as Velcro-like crackles. So basically, if you auscultate the lung, so basically they are called fine crackles or dry crackles or velcro like crackles. So I'm not sure if you guys know what velcro is, but basically uh, there's usually this how do I explain that, usually in bags or things like that, there is this black colored material on both side of bag, which you can kind of open and close if you want to, and that is known as velcro. So when you hear crackle in idiopathic pulmonary fibrosis, the crackle sounds like that, like a velcro, like you're opening a velcro. If you don't know, or if you didn't understand what I meant by velcro, maybe you can google an image and you'll understand what it is. It is very characteristic of idiopathic pulmonary fibrosis.
Thanks for watching. Please give a thumbs up and subscribe for more.